that thoughts, ideas, beliefs, ways of life that veer off from Christian doctrine are actually a mind distortion. Okay. And when you're dealing with patients that are extremely unhappy, it's clearly always a struggle as to explain cognitive behavioral therapy and realizing that you directing your own life with distorted thoughts is not actually going to make you happy. You cannot think yourself well, that you have to have people correcting you, which some people do not like. Um, uh, right, like it's sort of like AA where you hit bottom and you accept that your direction in life is not leading to your personal happiness. Okay. Sometimes you can base a belief on your dysfunction. I would say that's the biggest hurdle in providing psychotherapy to patients, and them actually believing it and not giving you a script because they're trying to get something they want. Like, it's really important for them to understand that they have a mental health problem that involves their very thinking is not correct. I'm sure people deal with this with depression, um, with the negative thoughts. Those can't be making you happy. So you have to accept a different way of thinking in order to give yourself some day-to-day happiness. So hopefully, uh, if you can get the right mental health team, that there's always going to be certain, what do you call it, compromises. This is why I personally like psychiatrists, and like, it's things have changed a lot, but I think that psychiatrists really do not do like a psychotherapist does, where they make a lot of compromises like that. I've always found psychiatrists to be sort of set-minded, and they tell you, um, where a therapist will listen to you week after week, and really try to compromise little changes. Hopefully, with you talking once a week, hearing yourself talk. How long have you been homeless? What were you doing when you became homeless? What caused you to be homeless? And changes that you can make that will contribute to ending your homelessness. Like, you pay your rent. You pay your rent. Okay, you don't buy marijuana, you don't buy Adderall, you don't buy booze, you pay your rent. You don't flip out on your wife, your caretaker, and take off. Um, Also, the thing about the power of attorney, I think some people are really against that. Um, I think if the person is in danger of making you homeless by their behavior, or themselves homeless by their behavior, that maybe think about that a little bit more, about what to do about it. From what I read, these power of attorneys, you can change it. You can change it. Clearly, you'd have to explain to your provider why you want to change your person, and see if that makes sense after talking to them. I'm sure that the VA has gone through this many times with Barbara Kent. Changing your healthcare proxy because you're trying to avoid your diagnosis and your healthcare plan.